Now, those of you who practice in the US know about this merit-based incentive payment system, or the acronym is MIPs. Now, anyone in the room participate in MIPs? You can put your hands up. I can see a few hands up. So this is a CMS-mandated merit-based incentive system. And the intent, I believe, is a good one, right? Because they tie payment to quality and cost effectiveness, as we talked about. It drives improvement in care processes and health outcomes, and ultimately reducing costs. So the intent is good ones. But sometimes, because the way it's implemented, the way it's collected, it is not quite as straightforward. And obviously, as anesthesia care provider, we try to strive for the best quality because these are all tied to payment. And those of you who participate in MIPS know that this year and next year, potentially 7 up to 9% of your Medicare reimbursement will be affected if you do not do well in this merit-based incentive payment system. And it can impact your bottom line if your Medicare population forms the bulk of your practice. Now, within that MIPS, there are a number of processes or a number of outcomes for anesthesia. And one of those is post-operative nausea and vomiting, focusing on how can we reduce the incidence of PONV. Now, we know that it is sometimes difficult, despite your best effort, to abolish post-operative nausea and vomiting. So the MIPS system simply says that if you have a patient who, based on the risk factors, which we'll talk more about, under the high-risk category, are you providing appropriate multimodal antiemetics therapy? So that is 2 and above. Now, if you fulfill that, then you fulfill the additional incentive payment. Now, you may think that, well, that is simple to do, right? I look at the risk score. If they got 2 or 3 risk factors, I just give them multimodal antiemetic therapy. Now, while you may feel that as an individual you have impact on that, but as a system, it's not quite as easily as you think to achieve that, because everyone has to adopt that incentive system, and everyone has to provide 2 or more antiemetics for high-risk patients.